I do, actually, Mr. Chairman. This is the one that Senator Menendez and I have worked on for years on this. This deals with the issue of tiering. This is the issue of how do you actually get access to biosimilars. What Senator Menendez and I had actually started with was generics, biosimilar, specialty drugs to get all that included. That went through a CBO process. We have then gone through the process to be able to narrow that and tailor that down to just the biosimilars. As they are quickly coming on the market, many of them are dramatically cheaper, and we want to make sure they actually end up on the formularies. Mr. Chairman, I would like to add in a few items for the record. Civica, in a letter that they have submitted, the Biosimilar Forum, what they have submitted, and then the HHS Office of Inspector General did a report in 2022 titled Medicare Part D and Beneficiaries Could Realize Significant Spending Reductions with Increased Biosimilar Use. I'd like to add all these three.
Without objection, so ordered.
The amendments that we have, we understand that this is going to be included, if at all possible, on it. What we're trying to do is to be able to drive down the actual cost to consumers at the counter, as well as the cost to the federal government and the taxpayers as well. I do appreciate all the staff's commitment to this. This has been a very long process to be able to work through this. But based on the evidence that we have seen going through this from the HHS, OIG, and from others that have examined this, I expect this policy to actually come back and save the government money because it drives down patient costs and it continues to drive down net prices as the branded price has to compete with a lower cost biosimilar. Simply stated, this would allow for when a new biosimilar comes on board, if it's the net price is significantly cheaper, and we're basing that off what's called the wholesale acquisition cost, it allows that to be able to be on the formulary, so we're actually increasing competition rather than biosimilars being forced out into the benefit of branded higher priced drugs that we actually increase competition. It's the basic principle of we want more competition, not less. We want more options for seniors, not less in this. And so we are submitting this as an amendment today. I understand that it's still working through the final process with CBO to get final scoring, so I'm not going to ask for a vote on this today, but we think it is essential to be able to get this policy in.
You've been doing very good work on this. Let's recognize Senator Menendez, and then Senator Crapo and I will respond about how we're going to be working with you. Senator Menendez.
Well, thank you, Mr. Chair. And during the committee's PBM markup in July, I, along with Senator Lankford, spoke about our legislation that would address unfair pricing gimmicks that only hurt patients at the pharmacy counter. And at the markup, you, Mr. Chairman, and the ranking member committed to working with us on this policy, and I very much appreciate both of your support and partnership, as well as that of the committee staff, as we work together to modify these provisions based on feedback from CBO. Under the current PBM and Medicare Part D plan structure, often a biosimilar drug, which should come with a lower price tag at the pharmacy counter, actually costs as much or more than the brand name drug product. That is, if the drug is even covered by insurance at all. Currently, many contracts explicitly block coverage for the most affordable biosimilars. That's just simply not right. This policy will ensure seniors can finally benefit, and financially, from lower cost biosimilars instead of being forced to pay for higher priced drugs solely because of pricing tactics used by the drug pricing minimum. So I appreciate the chair and ranking member's commitment to seek to include these provisions in the PBM package the committee moves to the floor, and I've enjoyed working with Senator Lankford in this regard.
And let me just be clear on this. We support the proposal that's being made by our two colleagues to break the PBM logjam and increase access to lower-cost biosimilars, and I'm going to recognize Senator Crapo for anything he'd like to say.
Yeah, I would just like to thank Senators Lankford and Menendez for your leadership on promoting patient access to biosimilars. Economists broadly agree that without this type of pro-competitive policy, low-cost biosimilars will continue to face coverage and placement barriers. The short-termism and gamesmanship of the annual PBM contracting bolsters preferences for higher-priced products, forcing both seniors and taxpayers to carry the burden. Senator Wyden and I have reserved savings in this bill as needed to ensure that we can advance this proposal, but I concur with OIG and a host of experts. This policy is a savings driver and a game changer. We are committed to getting this done.
I thank my colleague, and we are going to get this done.